Posterior tarsal tunnel syndrome, or PTTS, is a rare but significant entrapment neuropathy. It occurs when the tibial nerve or one of its branches is compressed within the tarsal tunnel, a narrow space on the inside of the ankle. This tunnel is formed by the flexor retinaculum and the bones of the ankle. PTTS can cause a range of symptoms, from numbness and burning to severe pain in the heel, medial ankle, and the sole of the foot. The condition is often underdiagnosed, making it a challenge for both patients and healthcare providers. Early recognition is crucial to prevent long-term complications. Tarsal tunnel is a small fibrous canal located on the inside of the ankle. It is bordered by the tibia, talus, calcaneus, and covered by the flexor retinaculum. Inside this tunnel run the tendons of three important muscles, as well as the posterior tibial artery, vein, and nerve. The tibial nerve is especially important as it provides sensation and movement to the foot. When any structure within this tunnel becomes enlarged or inflamed, it can compress the nerve, leading to PTTS symptoms. PTTS develops when something physically restricts the space within the tarsal tunnel. This can be due to trauma, repetitive foot movements, vascular disorders, soft tissue inflammation, diabetes, or even masses like tumors or cysts. Sometimes even normal anatomical variations, such as accessory muscles, can increase the risk. As the tunnel becomes crowded, the tibial nerve is compressed, leading to the classic symptoms of pain, numbness, and tingling. TTS can be triggered by a variety of factors. Trauma to the ankle, such as sprains or fractures, is a common cause. Vascular issues like varicose veins or malformations can also compress the nerve. Inflammatory conditions, including rheumatoid arthritis or tendinitis, may contribute. Diabetes increases the risk by affecting nerve health. Additionally, anatomical variations like extra muscles or abnormal bone growths can crowd the tunnel. Even poorly fitting shoes or repetitive sports movements can play a role. Symptoms of PTTS often start subtly and can be mistaken for other foot problems. Patients may notice numbness, burning, or tingling sensations in the heel, inner ankle, or sole of the foot. Pain often worsens with activity and may become more intense as the day goes on. Some people experience cramping, weakness in the toes, or even a cold sensation in the foot. In severe cases, muscle atrophy and difficulty walking or standing can develop, significantly impacting daily life. TTS is often underdiagnosed because its symptoms can mimic other conditions, such as plantar fasciitis or neuropathy from diabetes. The rarity of the syndrome and the variability of symptoms make it difficult for clinicians to identify. Delayed or missed diagnosis can lead to worsening symptoms, muscle weakness, and even permanent nerve damage. A thorough medical history and careful physical examination are essential for accurate diagnosis. Key part of diagnosing PTTS is the physical exam. One important test is the Tinel sign, where the doctor taps along the course of the tibial nerve at the ankle. If this elicits tingling or pain in the foot, it suggests nerve compression. Other provocative tests, like the dorsiflexion aversion test or the triple compression test, can also help confirm the diagnosis. These tests, combined with the patient's symptoms, guide the next steps in management. Imaging studies like MRI and ultrasound are valuable tools in diagnosing PTTS. MRI can reveal masses, cysts, or abnormal bone growths compressing the nerve. Ultrasound is especially useful for detecting nerve enlargement and anatomical variations. Electromyography and nerve conduction studies may help identify which branches of the tibial nerve are affected, although their sensitivity is limited. Together, these tests help pinpoint the exact cause and location of nerve compression. Most patients with PTTS start with conservative treatment. This includes rest, activity modification, and physical therapy to stretch and strengthen the muscles around the ankle. Heat or cryotherapy can help relieve pain and inflammation. Medications such as nonsteroidal anti-inflammatory drugs, corticosteroid injections, GABA analogs, tricyclic antidepressants, and vitamin B complex supplements may be used. Custom orthotics can support the foot and reduce pressure on the nerve. These treatments are usually tried for 12 to 24 months before considering surgery. Conservative treatments fail to relieve symptoms, surgical intervention may be necessary. Surgery involves decompressing the tibial nerve by releasing the flexor retinaculum and removing any masses or scar tissue. The procedure is usually performed through a small incision along the inside of the ankle. The surgeon carefully explores the nerve and its branches to ensure all areas of compression are addressed. Surgical outcomes depend on factors like age, duration of symptoms, and presence of underlying conditions. Surgical treatment for PTTS can provide significant relief for many patients, improving pain, mobility, and quality of life. However, outcomes vary, and some patients may experience recurrence of symptoms. Recurrence is often due to incomplete decompression or excessive scar tissue formation. Repeat surgeries are less predictable in their results. Recent advances, such as intraoperative nerve monitoring, aim to improve surgical outcomes by ensuring adequate nerve release during the procedure. Minimally invasive treatments for PTTS are gaining interest. Techniques like ultrasound-guided nerve release, endoscopic surgery, and pulsed radiofrequency are being explored. These approaches may offer faster recovery and fewer complications compared to traditional open surgery. However, most studies have small sample sizes or are based on cadaver models, so more research is needed to confirm their effectiveness and safety in real patients. Several case reports highlight the diverse causes of PTTS. For example, accessory muscles, ganglion cysts, tumors, and even gouty tophus have all been identified as sources of nerve compression. In some cases, patients develop PTTS after ankle surgery or due to rare conditions like lymphoma. These cases emphasize the importance of a thorough evaluation and individualized treatment plan for each patient. Not all cases of PTTS can be prevented. Certain measures can reduce risk. Wearing properly fitting shoes, avoiding repetitive ankle injuries, and managing underlying conditions like diabetes or rheumatoid arthritis are important. Athletes should pay attention to foot mechanics and avoid excessive stress on the ankle. Early recognition and treatment of symptoms can prevent progression and improve outcomes. Posterior tarsal tunnel syndrome is a complex and often underrecognized condition. It can significantly impact quality of life if not diagnosed and treated promptly. While conservative management remains the first line of treatment, surgery is effective for many patients when needed. New minimally invasive techniques show promise, but more research is required. Ongoing studies and increased awareness will help improve diagnosis, treatment, and outcomes for those affected by PTTS.